In a speech earlier today, Theresa May said that improving mental health support in schools is now at the top of her agenda as the government works to create a fairer Britain that truly does work for everyone. Her words. I'm now joined by Nick Haisman-Smith, Chief Executive of Family Links and the Nurturing Schools Network. Nick, thanks very much for being with us. Is this truly an achievable goal, getting teachers, getting educators to be involved in the mental health care process?
As a former teacher myself and now as Chief Executive at Family Links, I think there was a lot that was very good in what the Prime Minister had to say today, in particular about the need for more training for school staff. And that's absolutely essential. I remember when I was a young teacher myself feeling quite poorly equipped in many ways to deal with the daily ups and downs of school life, and definitely not well equipped enough to deal with the mental health challenges that young people in my classroom had. So I think there's a lot of really good potential news in this story today. The obvious challenge will be how the teaching staff, the teaching workforce respond to it, and in particular how the funding is followed up with.
It's important to remember, important to recognise the fact that so many problems when it comes to mental health start around the age of puberty and adolescence.
Absolutely, and in fact much younger. So I would say one of the concerns we have from the announcements today is that it sounded very much like this would be focused in secondary schools. I would argue that the work at Family Links, the work we've been doing for the last 20 years, has had most of its impact in supporting teachers who are working in the primary sector. Because we know there that if we're talking about a kind of an assets model of emotional health, where young people are building the skills of resilience, improving their self-esteem, looking at empathy, their social skills, a lot of the mental health concerns that may manifest later can be either prevented or at least the significance of them can be diminished.
So what are the mental health concerns of someone who's under the age of 11 years old? Many people just think of it. Obviously, we all remember our own childhoods and we tend to view them with rose-tinted specs, but for someone of that age to be suffering from significant mental health issues, it seems strange.
Well, I think in the younger years, there are two things I'm talking about. The first is that we do know that mental health issues are presenting themselves much younger. Now, if you think social media is a daily concern for primary school age children, especially sort of year 5 and year 6. So we can't ignore the mental health challenges that those young people are facing. But what I'm really talking about is the need for a preventative approach. So when we're working with young children in primary school, we're putting all those foundational building blocks in place, giving them a good sense of self-esteem, giving them relationships with a trusted adult, so that later in their lives, if there are challenges that they experience, they have somewhere to turn to, or they have the inner resilience, the inner skills to at least understand them and deal with those challenges a bit better.
I mean, what has been the response of the teachers that you've worked with? I mean, we all know, teachers are under incredible pressure. The nature of their job seems to change week in, week out. I mean, are they ready to take on an even greater burden? Because let's be fair, if they have this responsibility and they miss the signs of diminishing mental health, they will ultimately be blamed for it.
I think what I would say to that is that this is not something new for teachers. Teachers with whom we work in the hundreds of schools across the UK already deal with these issues on a daily basis in their classroom. This isn't something new that they are becoming aware of. And for many years, these issues are becoming more and more significant. So the opportunity here is to give those teachers the skills, the training, the curriculum resources to work with young students and older students in a really effective way, so they can do their job much better. But as a teacher, I remember so vividly those times when I didn't have the skills, I didn't have the resources, I didn't have the words or the language to really engage with young people in a way that would be helpful. And I think that's what the potential of today's announcements is, that we might have a workforce who feel confident and well equipped to do that. But also know when to refer on to specialists and to counsellors and to therapists. And that's something very clear that I think we should be talking about, that this isn't about teachers becoming therapists or counsellors. That's absolutely not what we're saying. But teachers do have a role to play in identifying those early signs of poor mental health in young people, but also doing that preventative work.
But what signs did you see in what Theresa May said today, that this is anything more than platitudinal? That she was saying we want to make sure that there is no stigma surrounding mental health. We want to focus on children. I mean, ultimately, doesn't it come down to a question of money?
I think the devil will be in the detail with these proposals. I think there will be a need for some extra funding coming for this work, but we've heard today the announcement of the Green Paper in children's mental health later this year, and I expect to see some further funding coming forward in that. But I would say schools are already doing some terrific work in this space, and for those schools that are out there who are looking to do this, I encourage them to get in touch, talk to other schools about the good work that they're doing, and to really see about what they can do with the resources they have, knowing that hopefully there'll be more resources coming in the short future.
Nick Haisman-Smith from Family Links and the Nurturing Schools Network. Thanks very much, and we'll keep our fingers crossed, shall we?
Thank you.